this section now is looking at how all of the components of the IPK and the Rehab effects correctives work together for the spine. All right, so for lower back pain, thoracic problems, neck issues, all of it we lump into this third part of Rehab effects called the spine. So firstly, thinking about our movement sins. If you can remember the sorts of things we're looking out for hyperlordosis in the overhead press. So if we imagine Michelle doing overhead press of some sort and then really kind of hyperextending somewhere through her spine, she does that really well, right? So we might have to watch her like a hawk that she doesn't do that if she is doing kettlebells. I've seen some kettlebell guys do the most extreme hyperextension elements, not realizing how it really does put a lot of stress on the joints of your lower back or your mid-back, wherever it is that you hyperextend. So watch out for the hyperlordosis on any vertical movements. Then on all of the bending movements, we have this very common tendency to posteriorly tilt too much or too early, all right? So there is the question then of when is too early, but for the most clients, they're doing it too much. You can kind of just take for granted they need to do it less, all right? So if we get Michelle to do a squat, the classic thing is, okay, coming up again, like the client will probably posteriorly tilt a lot earlier than that, Michelle. So kind of, yeah, they'll often round their backs and have no idea on how to keep their lower back straight. They can look pretty horrible in terms of just no real arch control. If they're doing a deadlift, now this applies to a lot of personal trainers as well as just normal clients. Trying to do a deadlift, they may, yeah, okay, so she's doing a horrible version there, but let's imagine you're pretty good, so you're keeping it straight most of the way, and then you drop under at the last bit of the deadlift. That is deadly, all right? For the lumbar spine, you might not even feel that you're losing your lordosis at the bottom of the deadlift movement, but that's when the time of the stress in the discs is at its greatest because the lever and the physics are so kind of loading of this lower lumbar spine. So what we're looking for is to keep that lordosis to the bottom of that bending movement, okay? So our third movement sin that we're keeping an eye out for, we've got our hyperlordosis in the straight position, we've got our excessive posterior tilt. The last one is that kind of tendency of the chin to jut forward. Again, really common amongst fit people as well as desk jockeys, you know? You might be doing an overhead press and that chin kind of sinks forward, all right? It's really compressing of all the delicate structures in the neck and, you know, leads certainly to just a lot of tension and tightness in muscles and stiffness in the joints. And it is in evidence very commonly. If you imagine, okay, you're doing, let's say, overhead press again. As we're kind of getting to the top of that movement, that chin sticks forward. That can also be a sign of muscles not really coordinating very well through the back here, and it's pushing that chin forward, okay? So keeping the chin back is a really important thing to begin to be aware of. Okay, so now focusing in on our screen trains, the most important one that we should be looking at is the waiter's bow butt wink, okay? So waiter's bow butt wink, if you want to demonstrate that one, Michelle, is focusing on how well can the client keep the lordosis. Good. So if we were to kind of have a quick peek, we could check that she's actually still got the arch of her lower back in place, and she does. She's actually quite flexible through her hips. It does make it easier for clients if they're flexible in their hips. Coming up from there, once you're straight, we're asking the client to tuck their tail under to some degree, all right, with not too much knee bending and not too much kind of chest dropping, all right? They're the two little cheats to that movement. As you're coming up and then you go to butt wink, you bend your knees and you drop your chest. So try and see if there's a lot of that. You want to try and reduce that a bit. Trying to get isolated just with that little bit of a tuck of the tail. Let's go again. Waiter's bow. So what's the waiter's bow? Imagine a waiter coming with a little platter of food. All right, perfect posture. They don't go as deep as Michelle, obviously. And then the butt wink. Yeah, great. You want to see how good they are at both components. The waiter's bow and then also that little butt wink. Both are important. And then we'd probably, just to check on thoracic spine and how her neck and upper body are with her spine, we're going to go into the kyphosis killer. Can you remember that one? So now the kyphosis killer, you're leaning body weight onto your arms again, and then it's all about how well can they get that chin from the forward position through to a line straight as possible between the head into the thoracic. So let's get you down into there, resting your hands on there. Drop your chin forward. Yeah, I'll move you here a little bit. So it's really getting that chin forward. Okay. So now if we've got good thoracic movement and neck control, then we should be able to bring that chin up. Perfect. And basically it's a nice alignment through here with a little bit of room for the fist behind the neck. Good. And dropping down again. Up again. Keeping that chin gently in. That's a sign of good thoracic mobility. All right. And again, as long as they can achieve that, then you can start to make sure it's happening in their training movements. But that is the essence of being able to have good posture. Again, we do it in this position leaning because it stops us being able to cheat through other parts of the spine. Well done. So in terms of loosening the spine, the most common things you're going to find yourself focusing on are mobilizing or stretching the thoracic spine into extension, but also into rotation. They're the two things that the thoracic spine commonly gets a problem with. Not having enough extension because you're stuck in too much of a kyphosis, or not having any ability to rotate and twist because it's all gummed up between the ribs and in the thoracic spine. So firstly, what kind of stuff have you got around the gym? Let's look at a few things we can use here for stretching Michelle's thoracic. The least kind of stressful would be lying on this little power bag, something like that. Okay, we can get her to open her arms right back, keeping the knees up a little bit, so we're sort of minimizing how much arching she's doing through her kind of lumbar area. And that's a nice little kind of warm-up stretch, just kind of opening chest, as long as she's not feeling any pinching in her shoulders. Chin's in a pretty good posse. Pretty happy with that as our kind of first little warming up into some stretching. Okay, so you can do that for 30 seconds, 5 lots. That'll really buy you some significant range for overhead work. Cool, thank you. You know, progressing up, making it a little bit more challenging, a bit more interesting. We can go from levels of hardness from other stuff we've found around the gym. Here we go. Let's see how she goes. Now this is going to feel a bit more like there's a big rock stuck in her thoracic. Got it between the scapula somewhere. Again, she's very bendy in there, so it's almost like I want to minimize her lower and mid-back bending and try and get it up higher. She could even support her head with her hands, like an elbows in a little, and just get that. It's nice to not have a really stressful neck, yeah? So supporting there is a great idea. Sweet as. That's pretty hard to beat, you know, that's comfortable, but it's a lot more targeted. Okay, we can get a bit more interesting. We might even want a bit of softness now. Now we're kind of thinking, okay, there's a few blocked up bits right up in there, Michelle, so let's see if we can get that. There's a bit of a point of, yes, you can definitely lift hips. Good. Let's give that a go. Get those hippies up. Great. And trying to just relax into that now, and that harder medicine ball is pushing up into that thoracic spine area. Trying to create that little bending moment, you know, a little bit level by level. Tell her to be taking it easy, make sure she can breathe, make sure she can still kind of talk to you and be present and not hurt herself. All right, last but not least, of course, the kettlebell affords us an even more kind of strong angle of mobility. I think we're going to go with using a bit of that edge there, all right? So now let's carefully kind of see how this works for her. So there's a little bit of an edge on the kettlebell. That'll be quite nice to just create a bit extra specificity on where we're getting that bit of loosening. I don't want it to move, so I'm just going to keep it there. Yeah, 10 of those little kind of movements, feeling where it is. As long as she's okay, not in too much pain, focusing on just bending over that kettlebell there to get that little bit of mobility, especially in the upper thoracic spine. This will really help that screen train called the thoracic kyphosis killer. Great work. All right. All right, we'll put those bits of kit away. There's our little thoracic extension mobility prac. Now we want to talk about how can we get a bit of that rotation. We already got it earlier in our pec mobility stuff. So when we're doing that real pec opening, that will give you some of that thoracic rotation. But this time we're going to get lying on your side with your arm behind your body. Okay, knees tucked up to your chest, quite high, and just tuck that hand out of the way there. This one is using the sandbag to kind of create that stretching into rotation from the back here. You can imagine yourself getting those ribs moving. You probably have a little towel under her face, of course. I'll just kind of demo it. Do you want that? Probably nice. Yeah, yes, actually, I do. Yes, please. A bit spiky. And so we're just going to use this as long as she's okay with how heavy it is. Actually, just going to use it to get that sort of movement, helping her to relax, as long as she's not in any sharp pain, feels like it's a bit of tightness being budged. Even just relax and, deep breath in and just a little bit of a stretch into that rotation. All right? A little cough. Was that what it was? Okay. So one more time, breathe in and relax, get that bit of rotation. Trying to get that stretch. Just keep in mind I've got those knees quite high up. That stops that lower back from doing a lot of bending because we want it to happen up in the thoracic. And I'll just get into a bit of a rhythm here, doing a bit of sort of oscillating, 20, 30 little reps one way, 20 or 30 little reps the other way, even a bit of sort of deep breath in and then relax and a bit of an extra stretch just at the limits there. Check with them if they're getting any pain. Hopefully not. Okay? So that's kind of like a bit of mobilization / PNF, just to get that extra bit of twistability in the thoracic spine. Two common little areas that relate to the spine, as well as mobilizing of the thoracic, but two little myofascial kind of loosening areas that are really nice to just have a couple of techniques for. One of them is this sort of neck area, on above the shoulder, below the ear, in this sort of commonly tight area. Stay away from bony landmarks like your acromion, your clavicle, supraspinous kind of ridge here. So stay away from bony areas and away from kind of that spine boniness at the center as well. Instead, we're just going to be in those soft areas. As long as she's comfortable, we can do just that gentle downward pressure. If you can, you could even just kind of support her so she doesn't feel like she's falling over. But you don't have to. We're just going to direct that pressure down, and even if anything, slightly backwards. So we're kind of pulling the tissue slightly towards her back, if anything. The deep downward pressure just sinking in. Again, be careful you're not on the bony bits out here. We really want to be in the muscle, loosening this tight area through here, helping her to relax. In addition to just this deep kind of pressure, I'm going to ask her to do a little bit of, gentle opening. Do the first few really gently and really carefully, just checking that she's okay with that. And then she can do a few more herself. Oops, we mistimed it there. Let me get in there first. Okay. And then now it'll feel like it's harder work. And release back again. Okay. Oh, super tight. Or is that your hair? Hair got caught. Hair alert. That's cool. You get the idea. Takes you about sort of a few minutes just to get that area a little bit softer, a little bit turned down. Second area we're going to work on is kind of equivalent to that. It's that really upper glute area close to your iliac crest and where your sacroiliac joint is. So the upper butt really likes a good bit of trigger point work. So if you just go straight down onto your side. So the second area after you've done a bit of neck is just to get this upper glute area, kind of getting a bit of trigger point effect. The only spot to watch out for is that hip bone, the greater trochanter. It's not a good thing for you to be sort of targeting and resting the handle or any part of the kettlebell on that. Go above that into that sort of real muscly area using the handle of the bell. It's perfect shape. Perfect shape. And just kind of directing some of that deep pressure in. If the client's really uncomfortable, I'd put something in between their knees so you've got a bit of that space. But for the moment, we'll just kind of explain it without. Be a bit higher up near the edge of the hip there, edge of the iliac crest. And we're chasing glute medius, piriformis, and even you'll probably end up hitting a few trigger points of things like glute maximus and those kinds of guys as well, right up near the edge there. All right, so 3 minutes. If they've got a bit of a history of lower back pain, a bit of trigger point release will go a long way to helping open up their movement. So there is no better piece of equipment than our TRX, suspension trainer, crank it trainer, whatever you've got, for supporting the body while we're doing big movements and really focusing on control. Now, the control is especially about the pelvis, the scapula, and also the head position. So keeping track of all those three main big body parts as they relate to what's happening with the curves. We're generally aiming for control of the lumbar so it stays in that little lordosis, regardless of whether we're bending or being straight. And this kyphosis here, a little bit of a kyphosis is a healthy thing. We don't want to hyperextend and lose that kyphosis or go into an excessive kyphosis. And of course, you know about the chin, all right? We don't want that chin to poke forward. That's really its main mistake, is just sinking forward under stress or bad habit. All right, so let's basically get you supporting. Lean backwards a little bit for me. That's right, Michelle. Okay, so hands are supported. We're going to do the backward leaning sumo squat, and then we're going to turn around, pushing. We're going to do just a kind of a normal type of squat on tiptoe. And in each of those two situations, very basic movement, we're going to keep our eyes like a hawk on what's happening in these different areas and focus in, retraining what's going on. All right, so sumo squat. Michelle, we're keeping an eye on that lordosis. As we know, she's really quite good at that. That's not a problem. Coming up again. Classic thing you'll see, of course, is that knee dropping in or that early posterior tilt. So how about you give us some early yucky posterior tilt. There we go. Nicely demonstrated badly. Brilliant. Another one of those. You can kind of be a bit sensitized to that. Watch that gapping, that opening of the little bones of the spine, okay? Might look pretty harmless, but inside those discs are under increasing stress the more flexed you are as you go down. That's the key thing to look out for in that scenario, apart from watching chin and so forth. So let's kind of come through and face outwards now. Now we're going to kind of lean forward on tiptoe, and we're going to be a little bit more complex, allowing for, okay, heels up, trying to get a nice squatting movement, looking for all the different components of the squat, okay? Looking for knees a little bit forward, hips a little bit back, trying to get that even. Very importantly, looking for that pelvis not to drop under. So we might get her to pause and not go through if she looks like she's tucking her tail under, or butt winking as we call it. There's your butt wink, nicely demonstrated, yeah. And down we go again. Note we are on heels, we're on tiptoe, off heels. Helps us to kind of be free to learn the movement. Head position is good. Let's just focus up here. A little bit of a touch with your dowel. Keep her focused there. Fantastic. She's doing a good job of bringing those knees forward. This time, let's just make it more like a deadlift. So all hip, excellent. This time she's training her deadlift control. Lean a little bit into it so you got that kind of suspension trainer to help you. Good. Squeezing up through glutes to help. Great. And then one more, deadlift. Focusing here. Great. And down. Now, we might even make this a bit longer if we needed to do more deadlift training. We'd extend those out so it's kind of like her support is here, and she can then do her little very isolated hip hinge practice, all right? Very, very good in this posse. And I think that's the most things we're looking for. Too much posterior tilt, perhaps too much hyperextension of the thoracic, chin coming forward. They're your important things, all right? This one here, forward leaning, we're now going to really upload or increase the challenge for her deep abdominal wall. So we want that wall to be strong and solid, protecting and, keeping her lower back safe. So very carefully, we're watching what's happening in neck, lumbar spine, as she, fully goes overhead. Now, if it's too hard for your client, just get them to bring their feet a little bit forward. It doesn't have to be super tough, muscling it out. In fact, this probably works against the client's improvement. We don't want them to posterior tilt. We don't want them to anterior tilt. So we're keeping that little bit of lordosis. Good. Shoulders can be the limiting factor, of course, if they feel a lot of stress around their neck and so forth. And then we might even bring it even closer, That's right, really focus on that chin back. Good, overhead, arms. Great. Good, coming back down. Set of 10 of those, break, set of 10. Just to really get that abdominal. So of course, that's going to stop that hyperlordosis, that you might have seen in the movement sins earlier. So now we're getting down and doing some serious kind of loading up of our abs. Okay, so we've got the little twisty way of getting in, which is a bit clever. I always forget to do that and I can't get in properly. So Michelle got it. So we're going to go on to hands as if we're on like all fours. Now, where you position yourself with respect to this loading point, right, will determine how hard this is, okay? In other words, if we get her to walk forward, okay, and then take up the load, so lifting here, then she's got to pull quite hard as she brings her knees up. Trying to bring the knees up. Then she's actually pulling against load. That's going to be harder for all that abdominal area. Okay, perhaps easier in some other respects, rather than if she walks herself to the other extreme. Hands up here, and we're just going to do some really subtle, deep stuff. I really rate this stuff over, for example, lots of planks. I'm just not a great proponent of the plank, I'll be honest with you. A little bit of movement, a little bit of instability, just to force a bit of a reaction in the stability system is definitely preferable. All right, so can we go forward a little bit, get your knees off? Yeah, just kind of hover those knees so the knees are off. Good. Maybe walk hands a little bit further forward. Okay, even just a little bit of a pause there, that's tough. That's hard work, right? Those abs are working quite hard. Psoas, the deep belly muscles, are working hard in a right kind of way. So as long as she's not overly rounding her back, right, we just don't want that excessive posterior tilt. We actually want that feeling of real kind of pinching in the hip, like closing there and keeping it controlled here. Let's go up again, just holding. She could extend one leg now. Can you, right, lovely. Breathe in and breathe out on the return. Swap to the other one. She's not going to have many of this one. Okay, and you can take a break if you want for a moment. Watch those wrists, people. All right, careful of too much compression. So if someone is having difficulty, you might have to put a little bit of support underneath the heel, potentially. All right, you don't have a lot of reps here. This is pretty high-level, tough stuff, but it is safe for the back. It's very safe. Let's go for one more little rep. Good, extending out, coming back, extending out, coming back. Is she up for two legs? We see. Oh, yep, she is. Good. And release. One more. Yeah. It's tough, this stuff, all right? It's a real ab workout. The suspension trainer makes it crazy hard. It really does. So you can play with a few different options down here. It's a big sort of effort to hold with your abs, use your psoas muscle, but also managing those curves and learning how to move well. Okay. The kettlebell swing is a movement that you want to get your clients doing well. You want to perfect it because kind of like the deadlift, it's the make or the break of a lumbar spine, of a lower back. If you can get that happening really well, get a client loading, they're away with it, you can watching them, there's no posterior tilt, then that system is going to become very resilient against lower back pain. On the other hand, if those glutes are a bit shabby, not really well developed, those hamstrings are a bit tight, overactive, and the client keeps kind of dropping under, posteriorly tilting, and it's not really that good, then they're probably on a downward spiral towards or certainly increasing the risk of lower back pain. So it's a make or break. So with that little no pressure, Michelle, let's see how your kettlebell swing is. Maybe side on so people can kind of see. Of course, it's all about, as you know, how that pelvis is moving. Can we move purely through the hip joint and not move through the lumbar spine is the essence of the kettlebell swing. Let's see how she goes. Great. So easy for her because her hips are mobile and she's been trained and her glutes work at that end quite brilliantly. So really, that's how to do it, okay? And I won't make a big deal of the technique of that. That's for other courses. We're just especially concerned about that lordosis in the lower back being maintained throughout, okay? Now, let's assume they're not doing so great. Let's assume that back is rounding, those glutes aren't that well developed. So pop down onto your knees. You can keep on that kettlebell for a moment. One way to kind of mix it up, add a new ingredient, is to go onto the knees. Now, what does that do? Putting us onto the knees straight away reduces the grip, reduces that kind of ability of the hamstring to overwork and do too much. So it forces more effort into the glutes, essentially. Okay, so our simple movement here will be the same thing, trying to get the hip hinge. Even if we go without load, just for the moment, just getting that movement good. It's essentially that little waiter's bow, isn't it? You know, that we did as a screen train. Getting that hip to do all of the movement. All right, little thing to just make it more interesting would be to have the tubing of some sort right in that hip join there. Off you go. Let's check I've got it right. Yep, it's got to sink right in there. And then get her to kind of fight me a little bit, coming back to 0 point. Down we go slowly. Sure it's even. Gently squeezing up. All right, there's a few cues I could think about here without wanting to be too inappropriate, but obviously squeezing the glutes is the idea. I have often talked about trying to hold on to that credit card, all right? So as we're at that point, imagine you got a credit card between your cheeks and you don't want to let it go. Take that credit card from me, all right? So squeezing the glutes is the key, trying to get gluteus maximus to work. This tubing definitely helps that, okay? Now we're going to go up into standing. We're going to start to apply it to the kettlebell swing with a few little variations. The first one being simply standing and having the tubing kind of same sort of deal as before. Doing that kettlebell swing movement. Again, just check it's low enough. Okay, that is a common mistake. Squeezing out of that position, great. Of course, clients can just tie that around a pole. Some of those big green bands or other colored bands are perfect for really learning and developing the control. Make sure gluteus maximus is really doing the work, all right? It's another one of those classically lazy muscles. Make sure that glute is doing it. Good. If we've got one hip that's a little bit of lazy, which can happen, we might focus in on one hip, okay? That gives the client brain a little bit of a focus on one side over the other. Can be very valuable. And of course, what we can do then is go on to 1 foot. So we'll now get her to balance on the one and do some sort of single-legged deadlift type movement. Great. Squeezing up. She can have a stick for balance on the opposite hand. That's not a big deal. I don't think that's the end of the world. It doesn't quite have the same balance challenge, but still, you're still balancing on the right and getting that glute to work. So no harm in using a stick or something and tapping that glute just to give the client the feeling of activation through that glute there. Good.